Hey, so in chapter 15, we'll talk about normal blood vessels and blood flow, as well as alterations in blood flow. So we're going to first start out here talking about the anatomy of arteries and veins. And for both arteries and veins, they carry three microscopically distinct layers, or tunica. The tunica intima is the innermost layer of a blood vessel wall, and it's composed of endothelial cells, which is a simple squamous epithelium, and this is in direct contact with blood as it flows through blood vessels. Tunica media is in the middle of the blood vessel wall. It's the smooth muscle layer, and it's also the thickest section in arteries. Adventitia is the outermost layer of a blood vessel wall, and it's more of a collagenous connective tissue that kind of really just holds the whole vessel together and in shape. So if you can compare arteries versus veins, one thing that's important to note is that in anatomy and pathophysiology, the artists that draw these pictures will show arteries as being red. Now, typically, though, that this suggests that the artery is carrying oxygenated blood, and it's not true that all arteries carry oxygenated blood. What's a better definition of an artery is that arteries carry blood away from the heart, and we know that there are some arteries going away from the heart that don't carry oxygenated blood, like the pulmonary arteries, which carry blood to your lungs, actually carry deoxygenated blood. But so just in definition, arteries carry blood away from the heart. They show veins as being blue because this suggests that veins carry deoxygenated blood. And although that's normally true, there are some veins in the body that carry oxygenated blood, like the pulmonary veins. Now, for both arteries and veins, arteries have a tendency to have thicker walls because they carry blood at higher pressure. If these vessels are carrying blood away from the heart, that means that they're carrying blood at its sort of highest pressure. And so the walls have to be thicker in arteries. Veins carry blood back towards the heart, which presumably would have lower pressure, so their walls have a tendency to be much thinner. Now, veins are also typically wider than arteries because veins carry more blood than arteries. I know it's kind of confusing, but it turns out that most of the blood in your body is actually found in veins versus arteries. It's about 60 to 40%. So 60% of the blood in your body is in a vein, 40% of it is going to be in arteries. Now, it turns out too that for arteries, they have a thicker tunica media. And this is because arteries will help change their diameter or shape to regulate blood pressure. So their smooth muscle layer has a tendency to be thicker. Arteries also have additional layers like elastic lamina. So between things like tunica intima and media, or media versus externa or adventitia, you find internal and external elastic laminas, which give arteries more elastic character or stretchability. So just in general, though, you want to see here that the tunica intima is what lines the innermost part of the vessel, tunica media is in the middle, and tunica adventitia is the outermost layer of a blood vessel wall. Now, we'll next talk about some of the principles of blood pressure, flow, and resistance. We know that blood flow, is the movement of blood along a pressure gradient. So one thing that's important to note is that blood only flows from high to low pressure. So if the heart is what's generating blood pressure, that means that in order for blood to flow, blood pressure needs to be lower, in more distal vessels, like away from the heart. That way that blood can move from higher pressure to lower pressure. And it turns out you find the lowest pressure in your blood vessels, like some of the larger veins have some of the lowest pressure, which makes sense because you want you want blood to flow from arteries, which have higher pressure, all the way through vascular beds, and then veins, which would have some of the lowest pressure. Now, pressure is really determined by the amount of force that's being sort of protruded or transmitted by blood onto the wall of the vessel itself. Now, the greater the pressure difference, sort of the greater amount of flow you'll find. So it turns out that pressure and flow are proportional in the sense that if blood pressure is higher and you have a larger pressure gradient, then you're going to have an increase in blood flow as well. Now, resistance is the word we use to describe how there's an opposition to blood flow. And resistance refers to the opposing forces that deter blood flow. So there are different factors that affect resistance, like vessel diameter, so that if resistance increases, blood flow will decrease, because if you have more resistance to blood flow, then it'll decrease. Um, Now, some ways you can change their vessel resistance would be by changing vessel diameter. So, for instance, if you vasodilate, like make a larger blood vessel, it'll have less resistance and therefore more blood flow. If you vasoconstrict, you'll have more resistance and therefore less blood flow. So what this is showing is how pressure changes over the course of your vascular system, from arteries all the way to larger veins. And you find that the mean arterial pressure remains fairly constant until you get to about the level of arterioles, which just precede capillary beds. And at the level of capillary beds, pressure will start to drop off pretty dramatically. And if you see the largest changes in pressure here, this also means you have the greatest amount of flow in this particular area of the vascular bed. Now, after capillary beds, which are your smallest vessels, these capillaries come together to form venules, which come together to form veins, and largest of your veins, which are the vena cava. And you can see that pressure has a tendency to slowly start to diminish as you go back to larger and larger veins. But what's nice, though, is that because we have a tendency to go from high to low pressure, blood will flow in that direction. So from the heart all the way back to the heart. Now, if we look at capillaries, we find that they're the smallest of your blood vessels. It turns out these are only about one cell layer thick, and there are millions of miles of capillaries all throughout your body. Now, you don't want the same amount of blood flow going to every single tissue at any moment in time, because you might have a circumstance where certain tissues may need more blood flow than other tissues. And so what helps regulate blood flow through capillary beds are these precapillary sphincters here. And so you find these near arterioles, and these precapillary sphincters can regulate blood flow to the capillary. So let's say if you wanted to decrease blood flow to a capillary, well, you can constrict a precapillary sphincter, which would cause like vasoconstriction here. That would increase resistance and therefore decrease blood flow downstream of that constriction. Or vice versa. If you wanted to increase blood flow to a capillary bed, you could relax these precapillary sphincters, which would vasodilate and increase blood flow through the capillary bed. Now, one thing that's important to note is that capillaries is where nutrient exchange occurs. So when you're talking about the exchange of gases, nutrients, and wastes, it occurs in the capillaries of your body because these have the thinnest walls, and therefore the greatest amount of diffusion or exchange can occur here in capillaries. Now, one thing that also gets exchanged in capillaries is also fluid. So not just gases and waste, but also fluids can move across the capillary wall. And this movement of fluid is dependent on differences in pressure gradients. And so there's different types of pressure you find either inside or outside of the capillaries. So we're going to move through and talk about some of the main types of pressure that can occur. So there's really two main types of pressure. We have hydrostatic pressure, okay, and osmotic pressure. So osmotic pressure. So hydrostatic pressures are fluid pressures, because we know that if you compress a fluid, it has a tendency to want to expand. So let's talk about the fluid pressure inside your blood vessels. We know that there's pressure or blood pressure here. We call this capillary hydrostatic pressure. Because blood's compressed, it has a tendency to want to expand, so it's going to force against the capillary wall, which means it's also going to force fluid out through small little spaces in the capillary wall into the surrounding tissue. And we call this capillary hydrostatic pressure. Now, if this were the only pressure that existed in capillaries, you would lose a tremendous amount of water across your capillary wall, which means your blood would dehydrate pretty quickly. So to reverse this process, we have some other interesting forces, like plasma colloid osmotic pressure. The osmotic pressure here is due to a solute called albumin, which is a plasma protein. And albumin helps to attract water from the surrounding tissue back into your bloodstream. And it helps to oppose the effects of capillary hydrostatic pressure. That way you can reabsorb some more of that water back into your blood. You don't lose too much blood into your you don't lose too much water from blood into the surrounding tissues. Now, we do find some smaller forces at play as well, like interstitial fluid hydrostatic pressure, which is a fluid pressure in tissue. it's typically more of a negligible component, but if you did sort of squeeze on a tissue, you could actually force water back into the bloodstream. And this is the whole idea behind pressure socks for edema. So if someone has a distal edema in their feet, they can wear pressure socks, which would ultimately increase the interstitial fluid hydrostatic pressure and force more of the water in that tissue back into their bloodstream and act to reverse the edema that they're suffering with. Another force that can exist here is interstitial fluid osmotic pressure, which is due to solutes in the tissues near your capillaries. And this is more of an attracting force. It can actually pull water from blood into the tissue. It's a smaller force, so often negligible, but it's important to note because if you get a lot of solutes in tissue, it may help draw an excessive amount of water from blood in that tissue. So when we talk about balance of the movement of water across the capillary wall, you want to have all of these arrows sort of equal and opposite. That way, the net movement of water should be pretty close to zero. However, it turns out that in most circumstances, we don't have a net movement of water that's zero. We actually have a net filtration, which is a net movement of water from blood into tissue. And one of the purposes of this is to help sort of introduce new water and bring in nutrients to tissues. And it's also an effect due to blood pressure. But what's nice though is we have a completely different organ system that acts to pick up this excess water in tissue and bring that back to our bloodstream, and that's our lymphatic system. So what we see here is a capillary bed, and we know that if we're losing water from our capillary beds, well, how do we bring that water back into our bloodstream? Well, luckily we have a lymphatic system, and these lymphatic capillaries are intimately intertwined with your blood capillaries, and what these lymphatic capillaries do is they pick up excess fluids, carry that in a lymph vessel here, and then bring that back towards your bloodstream, kind of by your subclavian veins, right where blood would enter back towards the heart. Now, we know from previous chapters that the lymphatic system also has an intimate role with the immune system because in these lymph vessels you find a lot of immune cells, which could also act to clean up the fluid and potential microorganisms that could exist in your body's tissues. Now, blood flow is controlled in a variety of mechanisms. It involves your autonomic nervous system, as well as other intrinsic autoregulatory systems, as well as venous blood flow. So remember, the autonomic nervous system involves both the sympathetic and parasympathetic nervous systems, and these act to control blood flow to and from, or increase or decrease blood flow to different tissues. Now, the venous system flow is controlled by a pressure gradient, from veins to sort of larger veins by both muscular pumps and thoracic pumps. So the thoracic pump is the process of breathing, which can help draw venous blood up towards your heart. There are also intrinsic autoregulatory mechanisms in blood vessels, whereby vessels can sort of regulate their own blood flow by sensing different chemical mediators of metabolism, that kind of stuff. Now, lymphatic flow is also similarly controlled by contraction of muscle fibers as well as a respiratory pump. And this helps to draw that lymphatic fluid back towards your heart. Now, a reduction in blood flow can impair the ability of proper gas transport and nutrients to body tissues. So if blood flow is reduced, then we could see things like hypoxia, which is low oxygen in tissue, ischemia, which would be a lack of blood flow to a given tissue, and this can lead to things like venous engorgement or venous obstruction. So if blood vessel obstructions do occur, this can occur in both arterial or venous systems, and these obstructions will lead to reduction in blood flow downstream or beyond that obstruction. And there are different things that can obstruct blood vessels. So some different types of obstructions could be things like tumors, fat, air, blood clots, even masses of bacteria can block blood vessels. So in the arterial system, obstruction will manifest as distal ischemia, so lack of blood flow downstream of those arteries. In the venous system, obstruction will manifest as edema because then blood will back up sort of proximal or upstream of that blockage, and that can lead to edema by increasing the capillary hydrostatic pressure, which would then force more water out of your bloodstream. Now, a thrombosis is basically kind of a stationary blood clot, We call these thrombus. So a thrombus is a stationary blood clot that forms within a vessel that's unbroken. Now, a cause of a thrombus could be where blood flow might be slow dramatically, and this can promote blood clotting. Or if blood becomes more turbulent, this can promote blood clots. Or if there's damage to the vessel wall, like the tunica intima, this can actually cause thrombus formation. So if we talk about thrombus occurring in a vein, this can be due to phlebitis, so venous inflammation can lead to thrombus formation, or you can actually have inflammation within a clot in a vein, which we call thrombophlebitis. Now, emboli are actually traveling thrombi. So if a thrombus dislodges, we call this an embolus, and it's material that forms a clot within the bloodstream. This is actually a traveling clot. So this clot can travel throughout the body and block a smaller vessel downstream. If that embolus enters the left ventricle, it can lead to ischemic stroke because the left ventricle pumps blood in the systemic circuit, and that can lead to blockage of blood flow somewhere else in the body, like the brain or another tissue that's receiving blood flow from the heart. Otherwise, if that traveling clot or embolus enters the right ventricle, it'll get lodged in the lungs because that's where the vessels become smaller, and that will cause what we call pulmonary embolus, and that can lead to respiratory failure. Now, emboli can be made of things like fat, neoplasms or tumors, collections of bacteria, air, and even amniotic fluid. So it's important to make sure that these things don't accumulate because these can turn into emboli, which can lead to things like pulmonary embolisms or basically ischemia elsewhere in the body. Now, vasospasms can lead to emboli, and it's basically a sudden constriction of arterial smooth muscles, which can obstruct flow. This can be mediated by hormonal changes, other food additives like monosodium glutamate, or other things that people can allergic to like gluten, or environmental factors. So some of the clinical manifestations of a vasospasm could be things like hemorrhagic stroke, migraine, or even angina pectoris, which is intermittent heart pain. Now, some other alterations in blood vessels, we talk about arteriosclerosis and atherosclerosis. This is basically a scarring of arteries, and the scarring of arteries can develop in medium and large size arteries. The process is initiated when the endothelial surface is damaged, and this initiates an inflammatory response that increases the vessel wall permeability as well as increases the diameter of the vessel wall. So what we see here then is what a normal blood vessel wall should look like in cross-section, but we can see that going from A to B to C to D, the progress of atherosclerosis. And what can happen then is you can get the accumulation of fatty deposits between the intima and media of a blood vessel wall, and this can lead to occlusion of the vessel lumen. Sometimes this vessel lumen can be totally or partially occluded, which can lead to downstream ischemia. But often what can happen is that due to the accumulation of plaque within this vessel wall, it can lead to a weakness of the endothelium, which it can make the vessel wall more prone to rupturing or tearing, which can lead to a thrombus formation, like a blood clot. And that blood clot can lead to partial or total occlusion of the vessel wall. Now, we'll actually go into the pathogenesis of atherosclerosis in future chapters in more detail, like when we get to the cardiovascular system. But one thing that's important to note for now is that plaques can develop from an excessive amount of saturated fat consumption. And there are different types of plaques, like stable and unstable plaques. And although plaque formation over time is sort of a normal consequence of aging, you can get an excessive amount of plaque formation from lifestyle and genetic predispositions. What's nice though is that these plaques can be reversible if people take the proper lifestyle changes, like proper diet and exercise can help reverse these plaques and diminish the sort of prevalence of cardiovascular disease. Now, Raynaud's syndrome is an alteration in flow where you see extreme vasoconstriction, which produces cessation of blood flow to fingers and toes. Therefore, you see color changes, like the fingers and toes can turn white or blue or red. This can actually lead to pain and numbness, and often cold can trigger these Raynaud phenomena. There are intrinsic structural factors that can occur like neuroregulation and locally produced mediators can be involved. But the treatment for Raynaud syndrome is really just aimed at enhancing circulation through biofeedback, helping someone relax, as well as providing calcium channel blockers, as well and prostaglandins to reverse this Raynaud syndrome. Aneurysms are actually local arterial dilations where arteries can actually bulge outward. They can be classified as true or false aneurysms, which we'll go into more detail in future chapters. But true aneurysms include different forms like saccular, fusiform, or berry, where it just refers on what these aneurysms look like. Aneurysms, for whatever reason, are common in the cerebral circulation as well as the thoracic and abdominal aorta. Now, these aneurysms, because they're dilations of the artery wall, they often are also a thinning of the artery wall, and aneurysms can cause vessels to become weaker and be more prone to tearing and rupturing. So this is what these aneurysms look like. Saccular is just sort of a slight ballooning of one side of the vessel wall. Fusiform is where you find a dilation on both sides of the vessel wall. Otherwise, a false aneurysm is going to be where you get the vessel wall that protrudes, but only because the layers of the vessel wall are starting to separate and split. And so you get blood that accumulates between the layers of this vessel wall. We call that a false aneurysm. Now, if these false aneurysms continue down the whole length of the vessel, we call this a dissecting aneurysm, where long stretches of the vessel wall can start to separate or tear away, almost like taking or tearing away layers of a particular structure, going down the whole tube. And these dissections can actually go the entire length of the aorta. So sometimes they're pretty severe and therefore hard to treat. Now, valvular incompetence is actually going to be where venous valves fail to function properly. Now, normally these valves prevent the backflow of venous blood, to other distal extremities. But if these valves fail, this leads to venous insufficiency, which can lead to varicosities or varicose veins, and this can lead to sort of engorgement of blood within the veins of extremities, especially like in the legs. Now, the treatment for this would be like stop to smoking, as well as regular walking and exercise can get venous blood flowing properly, and as well as drugs that can interfere with platelet aggregation can also help to alleviate valvular incompetence. So normally these venous valves are just these little infoldings of tunica intima that once they close off, they prevent the backflow of blood. But over time, if these valves have an excessive amount of stress, they can start to fail, and instead of preventing backflow of blood, they might allow the backflow of blood. So that means that venous blood can start to engorge and accumulate in veins of your extremities, which can lead to varicose veins. Now, these varicose veins is going to be where you have impaired venous return, which can result in superficial or darkened and raised tortuous veins. You find this common in great saphenous vein, and the treatment for this is going to be increasing venous flow. So you want to reduce venous pressure. It might involve things like sclerotherapy and surgical interventions. But ways to reduce varicosities would be things like elevation of the legs, avoid standing too long, wearing elastic stockings, which could help to squeeze blood back towards your heart, or things that might be more dramatic would be like vein stripping or vein ligation for totally incompetent veins that have reduced blood flow. And the reason why varicose veins aren't totally benign is that, remember from previous slides, we learned that if venous blood becomes sluggish or slow, then it's more likely to clot. So if someone has a lot of varicose veins, it puts them at risk for forming blood clots, which can form thrombi. And we know that thrombi can dislodge and form emboli, and those embolisms can lead to things like pulmonary embolisms or cerebral embolisms. So this is showing a more severe example of varicose veins right here. This is occurring in more superficial veins, which is why you can see them sort of protruding out through skin. Now, lymphedema is going to be where you have normal flow that's obstructed or altered. Primary lymphedema is going to be due to congenital anomalies or dysfunction of the lymphatic system. Secondary lymphedema is actually usually associated with a disease process, or if it's iatrogenic, like if a lymph vessel gets accidentally removed or plugged during surgery. But a common form of secondary lymphedema is actually an infection by a filarial worm. And this filarial worm, which is a parasite, it likes to live in the lymphatic system, and it feeds on lymph components. But these worms eventually block lymphatic flow, which leads to lymphedema. But the most common in the U.S. is lymph node removal. And if you remove too many lymph nodes, that can actually impair proper lymph flow, which leads to the accumulation of lymph in a particular body part. So this is showing an example of lymphedema. You can see in this individual's arm, her arm is really swollen. We wouldn't call this inflammation. This is lymphedema. This is not due to inflammation, but rather an accumulation of water in the tissues of her arm here due to an impairment of lymph flow. And you can see in this individual, the right versus the left leg, you can see the differences in the amount of water in the tissue. So presumably in this individual's right leg, they have impaired lymph flow. We call this lymphedema. Now in future chapters, we're going to talk about the mechanisms that we can use to reverse lymphedema.